My freedom does not end when your fear begins.
Right on.
Growing frustrations over the stay-at-home orders due to the coronavirus pandemic. Crowds gathered over the weekend to speak out against the orders and demanding that businesses reopen and people head back to work. State and Austin City leaders are working on plans to reopen the economy carefully so that we don't have a second surge of cases. And this morning, Austin Mayor Steve Adler joins us via Skype to discuss those steps. Mayor Adler, thank you so much for joining us on this Monday morning.
Good to be with you. Good morning.
Well, good morning. So let's start off by addressing those protesters. What would you like to say to those people who are protesting and clearly ignoring the rules?
Well, I think that everyone shares the frustration about what's going on right now in our lives, and everybody would like us to return to something that was more normal. I think we all feel that. But we don't have anything yet that has stopped this virus from being just as infectious today as it was at the beginning of March. All we have done over the last several weeks is stop it from spreading by decreasing the number of physical interactions we have. And that not only makes the people right there safer, it makes the entire community safer. So to those folks that were there, I say I understand the issue, I understand the desire, but when a group like that gathers, it not only makes them less safe, it makes the entire community less safe. And that's why I indicated yesterday that I thought that there was a better way to express our First Amendment rights than doing something that puts the entire community at risk. I said I thought it was selfish, and I believe that to be true.
Well, local officials are creating an advisory task force. At this point, can you tell us a little bit more about that? Who will make up that task force, that local force? What will be considered? Can you speak to that this morning?
We have a lot of task forces that are working right now. There's going to be one that gets formed this week, a group of business leaders to start talking about what individual industries might look like if at some point in the future there's an adaptive effort to get some businesses or some industries open. We also have task forces on the same question, looking at it from the public health angle, that are led by Dr. Escott, participation from some people in business, but also some people in the Dell Medical School and the like. But we have task forces on nursing homes and folks experiencing homelessness and lots of different things. This is a question that we're all going to be studying and taking a continued look at, and we have. I mean, remember again that there were three goals when we started here a month ago. We wanted to find the virus, we wanted to isolate the virus, and then we wanted to treat it. And that will be the continuing goal for an indefinite period of time. So the question is, as we talk about adapting to have more physical interactions between people, are we still able to find the virus? When we increase the number of physical interactions, we will increase the number of infections. Can we find them? So do we have adequate testing? We're doing thousands more testing than we're doing right now. And when we find it, can we isolate it? That's what people are doing right now. That's real good. If we find viruses as we have more and more people interacting, can we isolate it so that we can treat it? So we're looking at those kind of protocols to make sure that we can do that, because the one thing we will not compromise is public health. And we need to make sure that all the work and effort that people have done here over the last month is something that we just don't lose. We have to build on that.
Now, you mentioned the word adapting, and I think that's so important these days. You know, some businesses, well, a lot of businesses are hurting, some more than others, but talk about really the need to pivot and just kind of find creative ways to succeed, because a lot of local businesses are doing that.
You're absolutely true. You know, there are businesses that are adapting. Musicians are doing concerts remotely and online. We have businesses that are now doing takeout and delivery that have never done takeout and delivery before. We have to find increasing ways for folks to be able to engage in commerce without increasing any more than, without increasing in a way that hurts us the number of physical interactions between people, which is why we're encouraging everybody to really get widespread adoption of face coverings. People should wear gloves when they go out, because you can be out more if we can do those kinds of precautions. And that's what this is about. Can we increase the number of physical, can we adapt to this new world? Minimally increase the number of additional physical interactions, increase our ability to be able to contact trace, which means that if somebody gets a confirmed infection, can we readily identify every person that person came into contact with over the last 3 or 4 days? Probably most people today, if you got asked, who have you had a physical interaction with over the last 3, 4, 5 days, you can answer that question. So if you ever got confirmed, we can go back and trace it and find it and isolate the virus. Whatever we do in the future, we still have to be able to do that. So we have to find ways to be able to log and keep track of where people are and who they came into contact with. And then we have to make sure that we isolate well. We have to build cocoons around things like nursing homes and vulnerable populations. There are some people that we're just going to have to isolate and insulate and cocoon as best we can until we get a vaccine for this virus. So we have to be able to do that too.
Now, Mayor, one last question. I have a question from one of our viewers, from Jessica, who's in childcare. She said, city and state leaders are urging some daycares to stay open so that first responders can go to work. But she wants to know, how are childcare centers being protected? Is there financial assistance for maybe disinfecting services to help protect her and her staff?
Well, there is a Austin Travis County COVID-19 child care task force. I would urge Jessica to reach out to my office because they do have some assistance that they can provide. And the Austin and Travis County partners that are involved there will do everything they can to help facilitate that operation. That's a key. Child care is a key operation, especially child care for essential workers and for our first responders and for the people that we need and expect to continue working at this point in time. So if they need help getting to that task force, have them reach out to my office.
Great. Thank you so much, Mayor. And you know what? We're going to take a short break. When we come right back, the conversation continues with Brian and Mayor Adler. You're watching Daybreak. Thank you so much.